Trainee doctors are given special training on how to have a good bedside manner. This means they need to know how to relate with their patients, to give them news. Sometimes they just need to sit and listen to the patient while they're recovering, and this is part of the recovery process. Having a good bedside manner has been proven to improve the patient's recovery. So I think that early on you need to define what type of news or information you're going to be giving to the user, and then how you will give that type of information. What will the bedside manner of your bot be? Perhaps you won't have to give bad news. Maybe that will be dealt with by a real doctor. But what if you have to describe certain types of illnesses? How should you deal with that? How should you give that kind of information? Consider the different styles of communication a doctor could have. They could be very cold and efficient and not worry about engaging with the patient's emotions at all. That's one style. Some patients might like it. What if they engaged with a lot of chit-chat about football results or, things that aren't related to the actual discussion? Is that suitable? That's a question. Some users might like it, some might not. And then there could be something in between where the persona, the style is like, I care, I'm listening, I'm here for you. It's a matter of research to find out what is suitable for your design. I wonder if there is an argument for an unemotional delivery, because of course people relate to a voice assistant differently than they do with a real human or a real doctor or health professional. So perhaps they would feel more at ease because they know that they're not speaking to a real human and they can just speak openly. Something that I think is very interesting is that currently doctors have had to adapt their bedside manner. Many of them, of course, are wearing masks, so their face is covered. The patient can't see them, they can't see their facial expressions. They also can't touch the patient, they can't put a caring hand on their shoulder. So really, they're socially distanced, and so voice tone becomes even more important because it needs to carry more of the heavy lifting in the interaction. So I think that now to read up on anything you can find on how doctors have had to adapt their bedside manner to the current situation in the pandemic could give you some great insights into how to design the bedside manner of your bot. So, what will the bedside manner of your design be? Health professionals have to learn how to speak to their patients. They usually speak all day, and the way they do it can have an impact on the patient's recovery. So how will you do that in your design?